Hi guys, welcome back. It's Fitness Friday. This video goes out to Julie Doctor. No, I'm not dedicating a video to myself. This goes to the original first Julie Doctor from South Dakota. So she was wondering about some exercises for knee osteoarthritis. And the first thing I can say about that is make sure you know if you're acutely inflamed or not. So if you are walking differently, if you cannot tolerate getting up out of a chair, and it's been a few bad days in a row, you need to first ice, rest, and take some sort of anti-inflammatory, so Advil, Aleve, even putting some Voltaren gel, something like that if you have that in your home. Secondly, you can do a few exercises to help increase blood flow after that acute period of inflammation. So after icing about 2 to 3 days, you can start with heat. Heat's going to feel very good for an arthritic knee. And then you can add these exercises. So the first one that you want to do is standing just on one foot. I'm standing on my left foot. I've got my right arm in front of me. All I'm going to do is bend forward here. And I'm standing on one leg. So keep your core strong. Keep your back nice and straight. I'm going to try to do 10 of those in a row. Okay? If you can keep your back straight, you can go as far down as you can tolerate. So here I'm getting close to the floor and coming back up. You're going to feel this in your hamstrings and your glutes. Okay, so trying 10 of those. Nice straight back. Now, once you get good at that, you can hold a weight or anything from your pantry, gallon of milk in that one hand. Okay, so for the next one, I do have a prop. I have a ball. If you don't have a ball, I can show you a modification for this one. But you want to lay down on the ground, on your back. Get your heels up on the ball. When you first start with this one, you're going to start with 2 feet on the ball. Make sure you contract your core, so get that navel close to your spine. Lift up and bring the ball close to your buttocks. Come on back down. Okay? So you're trying 10 of these. You can do 3 sets of 10. Once you get better and don't have pain in the knee, you can progress a little bit. So go ahead and go to single leg. This time you're going to come up on the one leg, bend that leg. The opposite leg does the opposite thing. So I have my right leg on the ball. When I bend my right leg, I'm going to straighten my left leg, and vice versa. Okay, so try 10 of those. If you don't have the ball, you're just going to bridge. Double leg bridge versus single leg bridge. Okay, 3 sets of 10. Keep your core nice and strong. Okay, last one, I have a prop again. If you don't have any TheraBand, you can do a modification for this one as well, but I'm going to show you with a TheraTube that I have. Okay. So I'm going to put that in the door at about the height of my knee. And I want to put this right around my leg. Okay, so feet are about shoulder width apart. I'm going to let that knee bend nice and controlled. And then I'm going to drive through my heel. Let that knee bend, drive through my heel. See how I'm not moving my hip here? Just the knee. Okay? You can do about 30 of these in a row, a good 3 sets. This should not feel very fatiguing. This is just going to make you work on your control, which will help the kneecap move up and down the femur and give you a really good blood supply. Okay? So that's the fitness tip for today. I'm going to post another video later today to show you how to kinesio tape your knee if you're having a lot of problems. So tune back in later. I'm going to do that from work where I have all my supplies. Fitness Fridays, stay fit. Get out there, walk. One of the best things you can do for your knees is walk. That's the final thing I wanted to talk about, is stay away from plyometrics when your knee is really bothering you. So plyometrics include anything that involves jumping, running, cutting, accelerating, decelerating. If it's really bad couple days with your knee, make sure you're taking those things out. Walk in a pool if it's really bad, and add these exercises and see how it goes. Great to see you guys again. Thanks for stopping by. Stay fit.